places that have easy access to the outside world, if you will. And those are primarily the stab wound through the neck and the stab wound that goes, where the blade breaks off in the lung. The others are damaging vasculature deep inside, with the exception of that ulnar artery. Now that, of course, is going to bleed because, as you saw, it's got a very easy access to the outside world. So she's basically going to have blood inside of her that can now pour out. So at some point, and she may have been still alive when she was rolled onto that side, but had not yet bled to death. I can't tell you when in the sequence she was placed in that position.
And you can't tell whether she was conscious at that time?
No, sir, I cannot.
You didn't find any abrasions or bruises that would indicate prolonged dragging or grappling?
No, sir.
Because if she was moved from one room to another, you might find abrasions or scratches that would show her being dragged, right?
Yes, they might be there, but again, we're back to the absence of evidence is not evidence of absence, so lack of a finding doesn't tell us anything.
Doctor, are you aware that they never tested the blood from this carpet?
I'm not aware, sir.
You can't say definitively that that is Jasmine's blood. Scientifically.
No, sir, I can't, no.
Doctor, stand up if you want to. You said her head was about right here?
I believe it was in this area.
And then the body's right here?
Yes, her back along here, her buttocks down here, the legs coming up here, foot down here, and arm here, in that general shape.
All the stab wounds were on the right side.
Correct.
And all the blood would have come out the neck, under the arm, on the right side.
Correct.
Why is there so much blood down by the lower extremities? Why is there blood where her feet?
Well, again, we're losing, or she's losing, a couple of quarts of blood, and they're being absorbed into the carpet.
Why are they going all the way down there and not staying up towards the top of the torso? It's a flat surface. It wouldn't roll down. The blood wouldn't roll down a flat surface, right?
No, it's not going to roll down, but you're on an absorbent surface. So if she's basically covered in blood and still bleeding, then we can get a pattern like this.
Is your conclusion that she was in the fetal position based on the fact, or based on the fact of how you found Jasmine in the suitcase?
No, it's actually based on the likelihood of where the stab wounds are clustered. Again, we have an area that's not much bigger than a piece of paper. If we just say chest and shoulder and neck, where all of her wounds are clustered, with the exception of the left arm, but the left arm itself, again, is free. So if someone is just standing there and they're upright and not in a position, a constrained position, then I would expect to see stab wounds all over the body. And there would be stab wounds to the front of the torso and the arms and the back of the torso. And this is how, when we see people being stabbed to death, it's a very active thing, because nobody just sits around and lets someone stab them. they try to run, they try to get away, they try to grapple, they try to do. But in this particular case, we have 60 stab wounds that are clustered in an area approximately this big. And the most logical way that that happens is if she is in the position as found, as I noted in the autopsy report, because in that position, all of those stab wounds and incised wounds and stab incised wounds can be easily inflicted without having to roll her around and a lot of movements. She can stay in that position and receive all of those stab wounds. And because of that, that's the most likely position she was in when her stab wounds were inflicted. Now, can I say categorically she absolutely had to be in that position? No, I cannot. But in order to then get all those stab wounds, you have to very carefully wait until she's in a position where this side of her is exposed and only stab then. And that really isn't terribly logical or consistent.
So it's a coincidence that the position that you found her in the suitcase is the same as that when she died.
I don't know that that would be considered a coincidence. It's simply a lot easier. If she's already in a fetal position, then she's a lot easier to move into a suitcase than. So I don't really see that as a coincidence. That's simply consistent with.
What is rigor mortis?
Rigor mortis is the stiffening of the muscles after death.
How long does that take?
It depends is the correct answer. The books will give you all kinds of numbers and times when you'll start to see rigor mortis, and then rigor mortis is full 8 to 12 hours after death, and then it starts to fade after about 12 to 24 hours, and then by 48 hours it's gone. That is extremely variable. And the reason we laugh at it as forensic pathologists is the books and the TV shows all act like that is in a rigid time frame. The sequence is the same, but the time can be widely variable. And things that affect rigor mortis are things like how much exercise were you doing? How much lactic acid is built up in your muscles? Because that's what stiffens them. What is your muscle mass? Little children don't develop rigor mortis very well at all. Their rigor mortis, even full, is very weak because they have little muscle mass. Same thing with the little old ladies. People who are very bulky and robust and muscular, they may develop rigor mortis a lot faster. And it takes longer before it fades away, or what we call lysed or broken. So the amount just inside the body of change that can be produced on the timing of rigor mortis is pretty wide. Then we introduce environmental changes to it. And if you have a lot of air blowing across you, rigor mortis will set in quicker because your body cools faster. If you have a lot of clothes on, decomposition, including rigor mortis, will set in a lot quicker. There's a lot of the variabilities. Are you on carpet? Are you on a hard floor? Are you on bed? Are you covered up? Is it cold? Is it warm? Is it humid? Is it dry? These are all the variables that will affect the timing of rigor mortis. The stages all pass through the same set of stages, but the timing of them can be widely variable. So what it seems like in books and manuals and on the television is pretty misleading, actually. But it is basically the stiffening of muscles after death.
You don't know the length of time between her Jasmine's death and when she was placed in the suitcase.
That's correct, I do not.
It is possible during that time Jasmine could enter into the river, right?
Yes.
And that would have made it difficult to place her in a trash bag.
Or easier, depending. You know, if someone is already in a very compact position, it's significantly easier to slide a compact, relatively almost football-shaped object into a trash bag than someone whose arms and legs are askew that you've got to try to pack in there and break the rigor mortis, that is, to actually not break bones, but loosen the muscles enough so that you can bend them. So if she's already in that position, she's in a nice compact position, and would probably be easier to put her in a trash bag.
What about into the suitcase?
Well, again, if she's in that nice compact position, and the suitcase is large enough to fit her in, then it's actually a matter of simply lifting her and placing her in the suitcase in much the same way that at autopsy, I lifted her off of the trash bags and placed her over on the autopsy table so we could move the trash bags.
Are you able to determine whether or not the handcuffs start that? Was she still in rigor when she was taken out of the suitcase?
No.
And I know I asked you timing, and it's all very nebulous. Are you able to tell when it ended?
No.
Are you familiar with the term overkill?
Yes.
What is it?
That's a term that is common in popular media. It's not typically used by forensic pathologists, but basically what it means is that more wounds are inflicted than are required to cause death. And the psychologist's version of this is that overkill reflects a passion of some sort, an emotional event where they're angry with the person that they're killing, and so they beat or stab or do a lot more damage to that person than would simply be required to cause their death. And the theory is that because knives and fists and clubs and other blunt instruments and sharp instruments are more personal, that's why overkill is not frequently done with firearms. Because with firearms, you shoot them a couple times, they're dead, and that's it. It's relatively dispassionate. But in a passionate encounter, especially with knives, it's sort of a release of the anger in the same way that beating the pillow or whatever would be done to release all of that pent-up hatred or whatever that emotion is that's causing you to try to kill somebody.
You say anger, but there's a lot of different emotions and feelings and even passion, right?
Objection, Your Honor. Please approve.
Dr. Cogswell, the type of excessive injuries you observe are associated with excitement, correct?
Typically, yes.
And you tend to see overkill in situations when the attacker is excited, correct?
Again, typically, yes.
Do you believe that this is overkill in this case?
Well, again, this is not something that forensic pathologists, and particularly I, use as a usual term. There are certainly more injuries that are required to inflict death. And in fact, the injuries are not particularly, for the bulk of them, the injuries are not particularly life-threatening, but we do have a reasonable number of these injuries are significantly life-threatening. Certainly, they're all going to cause pain and they're all going to cause bleeding. The whole overkill thing is best addressed, I think, by the forensic psychologist as opposed to the forensic pathologist. And while we see these sorts of cases and they're labeled overkill, that's delving into people's minds is more of a psychiatry thing than a pathology thing.
Let me go back and ask you a couple questions about those handcuffs and shackles. Could they have been used to draw the body into a smaller position? Smaller than the fetal position that was already there?
Oh, smaller than the position as found? I don't believe so. The handcuffs, of course, just have a very short chain, 3 or 4 links. The shackle has a much longer chain, but that chain was used only on the right arm, and the right wrist was already shackled, or already handcuffed, rather, while the left arm was free. So it seems to me it would make more sense to attempt to attach the left arm to the ankle rather than the arm that you've already got attached to the ankle.
Is it possible? That's really my question. You weren't there, I wasn't there. Is it possible that that handcuffs or restraints could have made the body more compressed and smaller?
Well, certainly it's possible. As we always say, all things are possible that do not violate the laws of physics. As to whether they're likely or not, it just doesn't particularly make sense to do it that way. That doesn't mean that's not what happened.
One of the last things that you talked about on the record was the toxicology report, correct?
Yes, sir.
And in your report, you indicate that THC was not present, but in the toxicology report, as we saw, it says that there was an interfering substance, and so it wasn't one. Why didn't you notice that or mention that in your report?
Well, because I don't have any value for THC. I don't have a positive or a negative. So it's, again, I don't have any data, so the toxicology screen is negative.
But lack of evidence is not evidence of anything, right?
That's absolutely correct. I can't tell you categorically that Jasmine Pace did not have THC in her system, nor can I tell you that she did. We don't have any data for that. And so if you don't have any data one way or the other, it's a negative test.
Is it conclusive? Not negative, right?
Well, the toxicology report, as
Just in regards to the THC.
well, just regards to THC, it's not even inconclusive. It's simply the test was not done because it could not be done.
So the test was not done. Not that it was negative. We don't know if Jasmine Pace had THC in her system scientifically, right?
Right. That's what I said. We don't know whether she did or whether she didn't because we couldn't test for it.
Because there was an interfering substance. Do
Right.
we know what the interfering substance is?
No.
What could it be?
It could have been any one of a dozen or maybe even 100 different decompositional products. We simply don't know. That's not something that the toxicology lab is going to chase down because it doesn't really matter what the substance is that's interfering. it's enough that there is an interfering substance. It doesn't help you if you know that this chemical name of this interfering substance or substances, and it's more likely to be more than one. That doesn't help knowing that, because you still don't have the answer to your question about THC.
You used the term I'm not familiar with, decomposition products. What is that?
Well, when we decompose, things break down. And alcohol, for example, is a very good example of this. After we die, the bacteria in our gut will create alcohol and also consume alcohol, depending on which bacteria. We have probably half a dozen or so different strains of bacteria in our intestines right now. Some of those will use alcohol as their fuel, some of them will create alcohol as a waste product. When you start to decompose, those bacteria are released from your intestines and they travel through your bloodstream or through your vasculature. You don't have a bloodstream anymore. And that's what creates that marbling look that we see in decomposition. Prior to that, just the enzymatic breakdown of cells will release a lot of products that are within the cell. Enzymatic breakdown is the first step before decomposition. And this is what is called autolysis or autolysis. Auto meaning self, lysis meaning break. So the body is literally digesting itself. And because of that, that's when we start to get into the decomposition from the intestinal bacteria. So in a dead person who is decomposed, we may get alcohol positive on a toxicology test. But that alcohol may be just from bacteria, or it may be alcohol that they drank. Typically, if it's above 0.10, we can be confident it's alcohol they drank, because even the decompositional alcohols that have been seen over the decades in cases, they don't rise above 0.08, but so we have the fudge factor of 0.1. But there are other compounds. We have hundreds of compounds within our bodies, and as to which one is causing the interference, it could be multiple.
Well, you kind of jumped ahead for me, but let's go ahead and where you went about the alcohol. You had said on the record that you didn't smell any alcohol, correct?
That is correct.
But you did send, I think you, how many bottles of blood did you take from Jasmine Pace?
Only the one.
Why only one?
That was all it was. Remember, her vascular tree was empty.
So how many milliliters, or is that what you would measure it in?
That would be a 10 milliliter tube. This is, when you get your blood drawn, the big tubes that are about the size of your index finger, those are a 10 milliliter tube. They come in 10, 7, 5, and on down. The little ones that are used in hospitals. We only use the 10 milliliter tubes. And those tubes have a sodium fluoride preservative in them. The reason for that is that stops any enzymatic reaction within the blood. Certain things, compounds, particularly like cocaine, for example, will continue to break down spontaneously in the blood until you get it into a gray top tube, which breaks that spontaneous degradation, so it preserves the parent cocaine before it goes to its metabolites. Alcohol, same thing. If we've got some decomposition, then the blood that we're sucking up into the tube also has some of that bacteria in there, and they will continue to change the concentration of alcohol in the specimen. So that's why we use the gray top tubes. In this particular case, as I noted, since the vascular tree is basically empty and I couldn't get any blood out of any place in there, I used the blood that was still in her right chest cavity, which would have been the blood that came out of her right lung. But that was enough to fill a tube.
Council, approach for a moment, please. Yes, sir.
This is the toxicology report,
Yes, sir, it is.
and it looks like the tube that you used, you had a mass volume of 5.75 milliliters,
Correct.
and that's all the blood that you took from Jasmine Pace that you could have tested.
That I could, yes.
And so 3 different tests were performed, weren't there? Or I guess only 2 of 3 tests were performed.
Correct.
And we've already talked about THC. I don't want to go any more into that. But let's talk about Alyssa. It tested for all these other drugs. And why did an interfering substance mess up the mass spec, but didn't interfere with Alyssa?
Well, the answer to that is in your question, because these are 2 different testing protocols. So we have, this is HPLC, tandem mass spec, and these tests are run using ELISA, and all of these tests, the alcohols basically, are done using headspace gas chromatography. And so these are 3 different test protocols. And so then each protocol is defined as the best screen for these substances.
There are interfering substances in the blood, correct?
Yes.
And can you tell me, or if you have knowledge, whether or not that substance would have affected this test?
Well, no, because the ELISA tests are reported as not present. It's not reported as interfering substance.
I see.
If there was an interfering substance on these or on these, we would have had the same note, testing canceled due to interfering substance. So again, we're looking at 3 different things. It's kind of a Ford, Chevy, Dodge. You know, we've got, just because your Ford doesn't have this particular part doesn't mean that your Chevy or your Dodge is not going to have that part.
I understand, thank you. So let's talk about the alcohol. That test was done with gas chromatography, right?
Correct.
And that test for alcohol came back negative.
Correct.
But you said the way a body decomposes, the bacteria in the gut might create alcohol.
Yes.
It might also consume alcohol.
Correct.
Talk more about that, please.
Well, again, decomposition, like anything else, is a spectrum. There's not 2 stages. There's not fresh and decomposed. As we die, we start to first autolyze, and then we start to decompose. In this particular case, Jasmine Pace's body is at the borderline, basically, of autolysis to decomposition. And again, as I noted before, she's got some very, very early signs of decomposition, but she is not decomposed. So she's at early decomposition stage, which would be basically autolysis. That's where we're just breaking down the cell walls and releasing everything inside our cells. With decomposition, we don't have to create alcohol. And in fact, much of the distinction between whether you create alcohol or consume alcohol, whether your gut bacteria does that, seems to have a lot to do with your diet. And the toxicologist will jokingly say it depends on whether it was chili night last night. So that is a widely variable thing. You don't always see it, but when you do see it, again, anything less than a 0.10 is probably going to be decompositional if they're sufficiently decomposed. And that's going to be at a state significantly more advanced than what Jasmine Pace was.
But the extent of decomposition can be influenced by numerous factors, right? So the amount of time, obviously.
Yes.
The temperature.
Yes.
And so if this is the week of Thanksgiving in November of 2022 in Chattanooga, Tennessee, it's fall, it's cool out. Is that fair to say?
It is, yes.
And then other environmental conditions, and here the only other environmental conditions were adjacent to the Tennessee River. Is that fair?
That's at least where her body was found. Where it was in between then, I don't know.
Would being in a suitcase affect, or in a trash bag in a suitcase, having an effect on decomposition as well?
Certainly it will from the standpoint of external factors. Much of our decomposition has to do with flies, and flies lay eggs and maggots start to eat us, etc. And that's when we get into a bloated, putrefactive state. Again, we're nowhere near that yet. So the cooler we keep a dead body, and the more isolated from the outside environment that dead body is, the slower decomposition occurs. And this is exactly why at the medical examiner's office, all of the dead folks are in plastic body bags and in a cooler on stainless steel trays, because those are all the factors that will reduce the internal temperature of the body as quickly as possible and keep the environment away from it. So all of these things that you mentioned do affect decomposition, but in this case, we're not really dealing with very far into the whole decompositional process.
Alcohol also has a half-life in your body, right?
If you're alive, yes.
If you're not alive, does alcohol not dissipate?
Eventually, as the alcohol gets broken down by the decompositional bacteria running rampant, and again, we're at the bloat stage or even beyond, alcohol will tend to drop off because it's created and then it's used up. So the things you're talking about are far beyond the state of Jasmine Pace's body.
Well, we're talking about not just decomposition, but we're also talking about the length of time as well. So if Jasmine Pace died on November the 23rd, and you didn't do your autopsy until, was it December
1st.
December 1st? That's about a little over a week, or 8 days, correct?
Correct.
And during that period of time, or the longer that period of time goes, the less likely you are to find alcohol, or alcohol to be detected.
No, sir, that's not correct. Because you're looking at decompositional alcohol in someone who is not really very decomposed. So it is not unusual at all. In fact, it's expected that even in someone who is bloated with decomposition, they're all turn multiple colors, have marbling, etc., and are no longer recognizable, I'm going to get alcohol on a toxicology test. So alcohol doesn't just go away.
But the fact that you didn't find any doesn't conclusively prove that she didn't consume alcohol the night that she died. Right?
There's no alcohol in her blood. So she would have had to have died before it was absorbed into her blood.
And had she had a few glasses of wine, how long would it have taken her body to absorb that alcohol?
Well, typically with alcohol, you process and eliminate about 1 drink per hour, depending on your body size. In her case, because she's very small, she probably would not be able to eliminate more than 3/4, maybe even as low as a half a drink per hour. And a drink is defined as 1 glass of wine, 1 can of beer, 1 shot of liquor. They all contain the same amount of actual ethanol. So in the scenario that you're postulating, she would either have to have just had the alcohol before she starts to absorb any of it from her stomach and then be stabbed to death. Or she would have to drink the alcohol and stop drinking, and then at least an hour later, 1 glass of wine, and at least an hour later, probably closer to an hour and a half, maybe even 2 hours, be stabbed to death. So if we have drink a glass of wine and half an hour later be stabbed to death, then that alcohol is going to be in her blood.
So if she had a glass of wine and it was, or maybe even 2 glasses of wine, and it was 3 hours later, it's possible that there would be no alcohol in her system.
It's possible that she would have eliminated that because, again, the general rule is 1 drink an hour. And that will allow you to absorb the alcohol and eliminate the alcohol, but it depends on size. And so you have to factor that in. In her case, I think your scenario of 2 drinks in 3 hours, that probably would reduce her alcohol down to at least almost nothing.
Well, that's, so we were talking about reporting limits. I assume this ethanol means, in layman's terms, drinking out the alcohol that you drink.
That's correct.
10 milligrams per deciliters. That's the limit of the test, right?
Right, that's the lower limit.
So you can't say that Jasmine had no alcohol in her system. It could be that Jasmine didn't have enough alcohol in her system above the reporting limit, correct?
Which then is a negative test because the lower limits are there for a reason. It's because below that limit or below that concentration, you're in that noise zone and you don't know whether it's there or you don't or not.
She could have had 2 milligrams of deciliters of alcohol in her system. It's possible.
Again, all things that don't violate the laws of physics, et cetera, it's possible.
And that doesn't violate
But-
the laws of physics, right?
It does not.
And it doesn't violate
Objection, Your Honor. If you ask the question, the witness gets the answer.
Okay. Let him finish the answer, Mr. White, then you can follow up with the
my
question.
apologies.
If her alcohol level is at that concentration, that is a negligible concentration. And there's a reason for that. There's a reason that blood alcohol levels for DUI, for example, are set where they are. Other European countries, some of them set their DUI level at a 0.02. And remember, this is, when we're talking about these milligram per deciliter, that is not the same as a blood alcohol concentration. So when we talk about a 0.01, that is 100 milligrams per deciliter. And so the number that will be reported would be in milligrams per deciliter, and also additionally as a BAC, the blood alcohol concentration. So a .08, which would be the legal limit in Tennessee, would be reported as 80. So there's a big difference in units because the actual, or there's a big difference in numbers, excuse me, because the units are significantly different.
You had talked about strangulation, correct?
Yes.
And you had shown a picture. You said that you could not determine one way or another about manual strangulation, correct?
That's correct.
You wrote this report in this case,
I did.
and the report was accurate to the best of your ability,
Yes, sir.
and as thorough as you can be.
Yes, sir.
I don't think anyone would ever question you on your thoroughness, correct?
I would hope not, but it could happen.
And it was complete.
Yes, sir.
And you haven't made any updates or supplements to this?
I have not.
Well, in your report, you used the word unremarkable a lot. What does unremarkable mean?
Unremarkable means exactly that. There's nothing different about this particular thing that is unremarkable than in every other random normal autopsy. Basically, it's saying normal. But there's, of course, a variation of normal. There's a normal range for things like organ weights or what they look like, but
So if you look at your external examination, second paragraph, how do you describe the neck?
the neck is unremarkable. There's a reason for that, and the reason is very specific because, as I mentioned earlier, in the autopsy report, we don't want to have anybody reading that report have to hunt through the whole document to find the important things, the things that are associated with the death. So if there's something that's associated with the death or is significant, that goes in the injury section. Everything below the injury section, from here down, is assumed to be that person prior to the injury event, whatever the injuring event was. So when I say this is unremarkable, that's unremarkable, that means this is the condition of that person absent the injuries.
Now, we just said your report is going to be accurate, complete, and thorough, right?
Yes, sir.
Where can I find anything about manual strangulation in your report?
You can't, because again, I'm going to report what I see, what is there. That's not a report for speculation or supposition or anything that might be but isn't provable or demonstrable. So could there be manual strangulation? Yes. Do I have any data to tell you that there was? No. I have, as noted in the injury section, abrasions and contusions of the neck. That's all I can do with those. I can't tell you that those are associated with a manual strangulation or any other kind of non-sharp force injury other than these are blunt force injuries of abrasions and contusions or bruises. But I can't tell you what those mean because I don't have enough other data. So if I don't have enough other data, I can't call it a manual strangulation, but I can say I see these things. And the interpretation of those is something that doesn't belong in an autopsy report unless it's documentable and is something that can be diagnosed. from the findings. Because all that is a medical report that has the observations, the findings, and the diagnoses. It doesn't have any sort of what if.
Getting out of doc, contusions and bruises, are those kind of synonymous?
Yes, they are.
Okay. Did you find any contusions or bruises on the front side of Jasmine Pace?
No, not on the front of her torso. The side of the torso, yes.
Like, so what, that contusion, could that have been caused by falling on an object?
It could, yes.
Could it have been caused by slamming back into a doorknob?
It's a fairly large contusion for that, but it's certainly possible depending on how easily she bruised, basically, is because as we all know, young women tend to bruise relatively easily. That's fairly common.
So hypothetically, I'm sorry,
No, go ahead.
so hypothetically, if she were kicked and she fell down.
Kicked.
Kicked and fell down on an object or hit a doorknob or the side of the counter, could it have caused that contusion? Yes, the contusion?
Yes. It's a large contusion, but it has no pattern to it. In other words, there's no shape to it that allows me to say what the inflicting object is. A lot of times we can see corners, or we sometimes can even see the tread mark of a shoe sole or a ring impression, something like that in there. In this case, well, you saw the picture, it's just a large contusion. And so really there's not much that can be said about it. There's no fracture of the ribs underneath it. There's no laceration of the liver underneath it. It's just a bruise.
What's going on there?
Sir?
Thank you, Dr. Costello.
We've been in session about 2 hours now since lunch. We'll take our mid-afternoon break, come back in 15 minutes when that clock says 3:45, and